So I am a licensed doctor here, and I am trying to pursue internal medicine residency. So I have cleared the STEPS exams, USMLE STEPS exams, Step 1, Step 2, and Step 3, and have applied for the internal medicine residency. So let's see what the results come. We went for clinical rotations there, where you have to do 1 month of rotation under a doctor, and you get one letter of recommendation which is required for the application, the residency application. There was one tool called UWorld, which is basically a standard test material tool that all over the world they use it for the USMLEs. 8-hour exams of the USMLE, all the 3 steps. There are 3 steps basically: Step 1, Step 2, and Step 3. So all are around 7 to 9 hours exam. It's an overall application that you have to build, not just course. So it's here in India, when you consider the exams for masters, right?
Yes.
Surgery or medicine. So there is one exam called NEET PG.
Yes.
It's based on just marks. It's based on merit only. You don't need other things. In this exam, in STEP exam, there were like 7 to 8 lines question. They would give everything, every detail of a patient, blood pressure and heart rate, pulse, everything they would give. And then we have to, there's no one system that is involved. They connect all the subjects from all 4 years, and they ask you one thing: choose a good senior who can give you a very good advice, who can guide you throughout the USMLE journey. You have to build contacts, even with USA doctors, even with here, because what happens is a hospital gets around 6,000 to 7,000 applicants each year, and then they have to choose, and there are just 200 or 300 interview spots.
Hello and welcome everyone to another episode of House of Royce. Today we have a very special guest with us, Rushi Patel, who is one of my best friends and my childhood friends. And I'm so happy that I had him to come to this podcast and share his insights and knowledge with us. So just to briefly mention, Rushi is right now pursuing medical residency, internal medical residency in the United States. And I thought it would be wonderful for him to come and share about his education journey in India, and then his journey of planning to go to the States to pursue this residency, and how that whole process panned out with his challenges and his opportunities. So with that, I'll give the floor to Rushi. If you can just briefly introduce yourself.
Yes, absolutely. So hi Rohan, how are you?
I am doing great.
Definitely, you are in India, so yeah. So basically, hi everyone. I am Rushi Patel, and I did my MBBS here in the state of Gujarat, which is where Rohan is from. And so I am a licensed doctor here, and I am trying to pursue internal medicine residency. So I have cleared the STEPS exams, USMLE STEPS exams, Step 1, Step 2, and Step 3, and have applied for the internal medicine residency. So let's see what the results come. Hopefully.
I am sure the results will be positive.
Yes.
Knowing you, I don't think you have left any stone unturned to impress them. But Rushi, so can you tell us what factors? Let's go back a bit, right?
Yeah.
You did your high school here. You did pursue your MBBS. What was that factor that made you decide that you want to first pursue further studies abroad and be it United States? So what were the factors that you considered that led you to make that decision?
Yeah, so I think there were multiple reasons. So starting with here in India, after 10th grade, you have to choose which field you want to pursue. So either it's A group or B group. So if you go for A group, there is this engineering and every other field which involves the subject maths, right? And so I choose the B group, where you have to study physics, chemistry, and biology. And after 2 years, we give one exam called NEET UG. And just then we enter the MBBS college, that is the medical school here, the undergrad. So I was not sure until the second year of my medical school that like if I have to continue my career here or abroad. There were a lot of confusions going on. There were not enough information about the exams that we have to give to, especially go to the United States, right? So then my brother, who was pursuing engineering here, so decided to go to United States to do his masters, and he was there, well settled. He told me that it's good here in the United States. You should come. You should have an option open here to
Yes.
just explore. And if you don't like it, you can just go back to your country and see the amount of the so I started my preparation for the USMLE in third year, I guess, and I gave all my step exams, and it was very interesting how how the United Healthcare System, the subjects that we use was very meticulous and very practical aspect of medicine. So yeah, it just got me curious. So it just step by step, along with my friends, two other friends who were doing this. So we decided to just give a shot,
Yes.
and so it just continued there. We went for clinical rotations there, where you have to do 1 month of rotation under a doctor, and you get one letter of recommendation, which is required for the application, the residency application. So there were multiple factors, like my brother was there, the quality of education there, then the global recognition it provides,
Correct.
and the degree that we get in United States, the after residency, it is also valid in India here as well.
Okay.
So the
Okay.
option was open for me. If I wanted to come back there, the degree would be valid. So yeah, these were some of the reasons that I wanted to try at least some other path.
No, this is very fascinating because you mentioned a lot of different aspects of it. So the first one was, if I got that correctly, that there's a lot of uncertainty as to what exams to give, what are the steps. So how did you figure that out? You mentioned that you had your brother who sort of helped you understand the US landscape, but in terms of this medical exams, the steps related to it, you started preparing or giving it in your third year. Can you tell more about that?
Yes, yes, sure. So back in my time, it was like 4 years or 5 years ago when it was very new. The USMLE was very new to us because second year we just don't really care, after 4 years, what we're gonna do. We were just enjoying our med school life.
Yes.
So, but it was that the USMLE journey is pretty long, it just take 2 to 3 years even after your undergrad to give your exams. So I had to plan it beforehand. So I just searched the internet, asked some of the seniors who went for the same path. So grabbed some information. There were some, uh, prep material that we used, some videos,
Okay.
and that's how we started learning. There was one tool called UWorld, which is
Okay.
basically a standard test material tool that all over the world they use it for the USMLEs. So uh, slowly we started studying the way how the USMLE exams are given. So the pattern of it, there is actually 8-hour exams of the USMLE, all the three steps. There are
Oh,
three steps basically: step one, step two, and step three. So all
yes.
are around 8, 7 to 9 hours exam. And
Each
so,
one of them.
sorry.
7 to 9 hours for each one.
Yeah, for each one.
Oh, okay.
So yeah, eight. There are some 7 or 8 blocks, and basically 8-hour exam. You have to sit there, and it it I had to build some stamina. You have to practice it. Sitting 8 hours long, I didn't even study that much. Sitting 8 hours in that exam is it was very hard, definitely. But you need a lot of practice. There was some mock test also where you have to prepare, you have to give the test for like 5 to 6 hours long, and the exam was very difficult, I must say. It's not that easy exam. You have to just keep guessing so many answers. You don't even know how the exam went. So I think whoever is listening to this would definitely agree that after giving your step exams, if someone asks you how was the exam, you do not know. You do not know if you will fail, or you do not know if you will score amazing marks. It's it's just guessing work. But yeah, eventually it's all depends on the mock test, how you scored there. And It's just basically guessing work. So yeah, so this is how it went away. I took it step by step, because there are a lot of things that is involved. Step exams is just one part of the application. Then you
Okay.
have to do the rotations, clinical rotations, where you have to uh, get letter of recommendation from the doctors there.
Okay.
So there are some research aspects. You have to, do research work, have some publication in hand, some volunteer works also. So it's an overall application that you have to build, not just course. So it's here in India, when you consider the exams for masters, right?
Yes.
Surgery or medicine. So there is one exam called NEET PG.
Correct. Yes.
It's based on just marks. It's based
Hmm.
on merit only. You don't need other things
I see.
for the grading. But in USMLE, it's not just marks. You need everything else. Even if you have great scores, they will not take you because you are lacking in some other aspect of the application.
Hmm. This is very interesting. So they look at the person. They look at overall, aspects, not just one. They look at the academic skills, but also extracurriculars
Yeah,
and
yeah, yeah.
how well you balance it. So with this also, what other changes or differences, I should say, did you notice between your studying that you did in India with the Indian education system pertaining to med school and what you got exposed to while preparing for USMLE? What were some like major changes or differences that stood out to you?
Yeah, I think there were some changes definitely. So I would first explain about the Indian healthcare system here
Yes.
and the medical school basically. So here we have to do 4.5 years of studying here and 1 year of mandatory internship. I
Hmm.
think we call that clerkship in United States.
Okay.
Its total is 5.5 years, five and a
Okay.
half years here. So the first year, second year, third year, each year we have final exams where it's a theory exam. You have to write. It's not a multiple choice questions. It's a
Hmm.
theory questions. And so there were a lot of, definitely there are practical aspects of medicine, and also how you study. Every person, has a different pattern of studying here. But there is a lot of remembering here. That is,
True.
memorizing, a lot of memorizing here.
Yes.
And I mean, it's given, in medical
Yes.
school, you have to remember something. You can't have some logic in a pharmacological drug. It's a name. You have to
Yes.
remember. So definitely there is a lot of mugging, memorizing, and you know the exams are definitely tough here, and there are a lot of competition here because there are a lot of people in one school. I myself, in my class, there were 250 students in one class.
Okay.
So and the exam which was taken, this Gujarat University, it involved, I think, six more colleges where there were 250 students each. So we have to compete. There were around more than 1,000 students. So we have to
Oh my
compete
God.
with them. We have to score well, and the passing score was about 50 percentage.
Okay.
So yeah, so scoring even like 60-65 percentage, it was very, very good for us.
Yes.
We achieved
Yes.
something. People are just, here, like, just let us pass first, here.
Correct. Yes.
Above 50% it's good.
Yeah, because you have studied so much,
Yeah.
in your 10th, 11th, 12th, with
Oh my God, yeah.
everyone, your parents and teachers saying it's only till 12th and then you'll be all set. And then you go into this college, especially in medical school, and you realize, no, it hasn't ended yet. You have to continue this for another 4, 5, 6 years.
Oh, definitely. Not even 4, 5, 6. It's more than that. After 10, it's just 10. You can just 11, 12 is nothing. Then
Yeah.
comes 12th exam. Then comes
Yes.
MBBS. Then master, super specialty. Then to get experience.
It never ends.
So it's a lot of things. So yeah, coming back to the question. So this was the Indian healthcare system, the medical system basically,
Yes.
med school. And in the United States, where we were learning from U World, it had a lot of practical aspects,
Hmm.
right? So in Indian healthcare system, when there are exams like NEET PG or NEET UG, there are just facts that they ask, 1 line or 2 line questions.
Okay.
And in this exam, in STEP exam, there were like 7 to 8 lines question. They would give everything, every detail of a patient, blood pressure and heart rate, pulse, everything they would give. And then we have to, there's no one system that is involved. They connect all the subjects from all 4 years and they ask you one thing.
Oh.
They give you a patient of stroke, and then they get to the drug, which drug you give, what is the mechanism of the drug. That is the answer. So it begins with stroke. You think it's a medicine subject, but then it comes to pharmacology. So it's, and this is for 8 hours. The torture is for 8 hours. So, but
Oh
yeah,
my
so
God.
I think United Healthcare System definitely focus more on practical aspects of medicine,
Yes.
which I think is, really helpful when you get into the field where you treat patient, because the patient would come with such complaints, such the stem of the question. They will
Correct.
not come like, I have hypertension, what drug will you give? You have
Correct.
to check everything.
Yes.
So definitely this system. And when I went for my clinical rotations there, I saw a major difference in both the systems. In India, I would say there is a lot of exposures of different diseases, definitely, because there are a lot of patients here coming. You have to handle a large volume of patient, and you have to manage. I remember that when I was posted in one of the busiest hospital in Ahmedabad, the city I live in, there were like every 10 minutes there would be one emergency patient coming in, rushing in. There were not even, beds available to put them. There were like heart attack patient, stroke patient, some alcohol withdrawal patient, different. And handling such cases, it just, builds resilience and adaptability.
True.
In the United States, when I went for my rotation, uh, I did my OPD. It's basically outpatient department. And the patient there came, there were, I think, daily a doctor would see, the PCP would see around 30 to 40 patients.
Mhm.
So there was EMR there, electronic medical record, right?
Yes. Yes.
All the informations are given there, even the past 10 years history. You have everything.
Correct.
And generally, the patients there are mostly follow-up patients. You know, out of 30 or 40 patients, there will be just 5 to 10 patients that would be, first time they would be coming there. But apart from that, 20 or 30 patient would be just follow-up patient. You have to just monitor disease. So, and the time given to the patient was also, like a good amount. It's like
Yes.
at least 15 to 20 minutes they listen to the patient, because they have time. There are not large volume of patient. In India, you just can't do that. Okay. There will
Yes.
be like 100 patients lining up if you give the patient like 10 minutes or 15 minutes.
Yes.
So there was some difference. And definitely the follow up in India, the follow up is very difficult. It's like such as minor diseases like hypertension, right? I mean, it's not minor, but still
Yes.
hypertension. But people don't follow up. The doctor gives the medication, the patient doesn't come for 30 years, next 30 years. Whole cycle. It's like, doctor has given this medication, I'll take it. So
Yes.
forget it. So, but in US, I think people do come follow up, right? Every
Yes.
4 weeks, 6 weeks, they
Yeah.
come and check up. So the doctor knows they're monitoring the patient.
Yes.
And yeah, so these are some of the differences I noticed. But
Mhm.
uh, let's
No,
let's see.
I completely like, when you mentioned about the questions, I could relate to it because in my pharmacy school, when I was, giving exams,
Hmm.
we had therapeutic subject. And exactly as you said, the questions were all case based. There were very few questions that were direct memorization. We had such, but most of the questions were looking at patient holistically and combining all the concept that we had studied in pharmacology, medchem, therapeutics, and then how do you apply it? So mostly application-based questions. And even, in I remember during my pharmacy rotation in Boston, I was in one of the busiest hospital there, and it for in the beginning it was very surprising for me because they would see 30, 40 patients and they'll be like, oh my god, we had a busy day. And then
Yeah.
I think back as to how many patients, when my dad would come home and tell me that this many patients he saw in his lab, and I was like, this is nothing. But then it's different, right? As you said, both the population is different, the what the patient needs are different, and the way the healthcare provider has to assess that is different. In India, if they give that much time to the patient, we wouldn't end up seeing everyone. And
Yeah.
I think there's things that, from what I have learned, the International Medical Society, they sometimes come here to learn that how the Indian medical system
Yeah.
manage, even with this big of a population, with such short time span that each HCP has, a healthcare provider has with the patient, to diagnose it, to know about the past history, to give them the medication, to tell them how to take it. There's so much that they cover, and they do it with such a small time. And most of the cases work out. Although, of course, you give such a short time, some things is left out. But then you compare it to the US, and sometimes I feel, is it over meticulous?
Yeah.
Because it's everything is noted down. You actually give, as you said, time to the patient. The patient is taken through the entire process. So I definitely see the pros and cons right there. One of the biggest thing in the US, from what I have seen, when you compare it to India, is the cost.
Yeah.
Uh, it's crazy. I remember the time. So in my first year of pharmacy school, I got malaria, and
Mm.
I was admitted to the hospital nearby my university. I was giving an exam, and I got shivering and high fever. Uh, and the public safety of my university, I went there. I was like, yeah, something's wrong with me. I was literally shaking. Can you do something? They didn't have the medications, so they called ambulance 911, and the ambulance took me to the hospital. Well, long story short, I got the bill of the ambulance that took me maybe around 1 kilometer. The hospital was right next to my university, and the bill was about $2,500 for
Wow.
that distance. And let's not even talk about the bill of the hospital. But that's how crazy it is. In $2,500 in India, you could have, a
Oh my.
patient can get medical care, not just the patient, the entire family can get medical
Yeah.
care for their lifetime, right?
Definitely.
So it's very interesting. But yes, I hear you. So thanks for sharing that differences between the education system here and education system there. So you finished, you successfully passed all the USMLE stages.
Yeah.
Now you went there for the clinical rotation.
Mhm.
So now I want to know from you is what, when you went there, right? This is not just the education piece, but just in terms of the time that you stayed in the States, the culture, the environment, everything is different. How did you accommodate to that? What were some challenges that you faced when you went from India to the States?
Yeah. So there were definitely some challenges and some exciting things also. But I guess when I first came to the United States for my rotation 2 years back, I was not here for some tourism. I was not here to just visit some places. I had to do some work here.
Correct.
So I was in Brooklyn in the state of New York. So the first day I remember managing everything, waking up at the clinic started at around 8 o'clock, and my house was very far. I had to take two buses and three trains to reach there. Two buses, I think, and one train. Yeah. So
Oh my God.
just wake up early, just drive through Google Maps, just doing that little things, the
Yes.
things which everyone does there, which is very normal there, and here to just wait at the station and grab the train. So that part was after some days it was like very normal to me, but initial few days it was difficult for me to navigate everywhere. So I remember there were in New York there are two stations there where we have to take the subways basically. So on the both side of the road, there are stairs where we have to go down and take the subway. So
Yes.
one is downtown and one is uptown. So I
Hmm.
always used to confuse that both. Which few
Yes.
days. Yeah. So I used to travel back that the wrong way, then you have to come back. So it was uh, it was fun actually.
Yes.
Like how
Yeah.
stupid it was to just take the opposite way. But yeah, that's how I learned few things. Then in the clinic when I came, I had to see some patients. I had to measure their blood pressure and everything. So one aspect of the challenge that I had was with communicating
Hmm.
with patients. So it's not that we don't articulate it better, but some accent, they might not understand some words we are saying.
Correct.
I was not able to understand some words they were saying. So
Hmm.
initial few days, I think 10 to 15 days, it was difficult for me. But then, after some experience and some, familiarity, it was okay. It was easy then.
Yes.
So I think communication was one challenge, and definitely it's coming out of your comfort zone, exploring new city. You don't know, what place to eat, and which actually I remember that I had to book my house from here in India in Brooklyn. I There were just some photographs, there were, I don't know how the streets were, where it was located,
Yes.
and so it was a hassle. In India, like choosing where you are going to stay for 1 month in United States without even knowing how the vicinity is, how.
Yes.
But yeah, so that was also some challenge, I guess.
Correct.
And apart from that, I think initial few days will always be tough wherever you go,
Yes.
even different countries, not just United States. Wherever you go, even in here in India, in different states, if I go, it will be uncomfortable, it will be scary, sometimes.
Yes.
But after 10 to 15 days, 1 month, you just kind of like it, it's
Yes.
very comfortable now, and now I don't want to go somewhere else and start that process again. I just want to
Yeah.
stay.
And you were in New York, right? You were in
Yeah,
one of the busiest cities in the world. You went from being in Gandhinagar in Gujarat, which is, one of the calmer cities,
yeah, yeah.
uh, to there. So when you came back, which one did you like more? The calmness here or the busyness there?
It's just grass is always greener on the other side,
Yes.
If I stay here, I want to go to New York. If I'm New York, I want to go here,
Yes.
stay here.
Yes.
So it's always 50-50%. It
Uh,
depends on mood.
So you mentioned, before that you actually had a couple friends with you who were going through this process, and I was just thinking that it's very practical that when you are shifting states, when you're shifting nations, to have that stress and to feel alone, and to have those challenges. But when you went to do this internship, did these friends also work there with you, and did that make it easier rather than going alone?
Yeah, yeah, definitely, definitely. That it made a lot of difference. So I remember in 2022 when I went for rotation in Brooklyn for
Mhm.
2 months, I was alone, managing all the transport and everything, even the groceries to make food. I was alone there. And the next year I went with friends in 2023.
Yes.
And it was way easier. You have a company, you can talk, basically, you can talk. It's familiar faces. So it's very comfortable with them. You just travel with them, try different local cuisines, have fun
Yes.
activities there. And yeah, so it was definitely, I would say, easier
Mm.
with friends.
No, and so now you finished the internship.
Mhm.
Now you are preparing for the internal medical residency. If I want to ask this very cliche questions to you, if you were to look back into time 3 or 4 years and give advice to yourself, what would you change in the process that you did to pursue, USMLE, and the steps that you took? And this question is coming from a perspective that I know many people who will be watching this podcast uh, are planning to come to the US, and I feel majority of them, are have done some kind of medical education here, done their bachelor's, done MBBS, and are thinking of pursuing this, right? So I want this section to be dedicated as to what advice you would give to someone younger than you who are thinking of doing this.
Yes, sure. There are a lot of advices, but few things that I want to change. If I would give advice to my within students, my
Yes,
juniors.
yes,
Uh, I guess the one thing is there is a lot of misinformation that
Hmm.
is going on with this, that it's very difficult. You can't, the exams are very difficult. You can't even sit for 8 hours. It's long process, 3 or 4 years. But I usually say this to my juniors that, just don't look at the exams. Either you give NEET, that is the PG in India, or you give USMLE. Don't decide your career based on the exams. Decide your career based on where you want to live after 10 years. Okay. So you will clear either that exam or that exam, because you entered MBBS. That was also very tough.
Correct.
It will take time in United States, USMLE exams, but
Yes.
you have to decide after 10 years where you want to go,
Hmm.
not based on the exams. So that was definitely one of the major advice I want to give to the younger people who want to continue this career. And the other thing is that there are, choose a good senior who can give you a very good advice, who can guide you throughout the USMLE journey, right? And you can talk to them, you can ask for them, and keep asking questions, keep building contacts.
Yes.
Very important for these to match into the internal medicine. Right now, I have applied for the residency here, and the interview seasons is going on for 6 months. And I have seen that there are a lot of applicants are applying this year, and this will also increase in next years. It keeps on increasing
Yes.
in upcoming years. You have to build contacts,
Hmm.
even with USA doctors, even with here, because what happens is a hospital gets around 6 to 7 thousand applicants a year, each year, and then they have to choose, and there are just 200 or 300 interview spots. So
Hmm.
from 6,000 applicants, they have to choose 300 applicants, and every applicant has some unique characteristics. It's very difficult for them also.
Yes.
So build contacts, because what they will do is ask the doctors which are working in the hospital, do you know him? Do you know her?
Hmm.
If she's good, if he's good, then we can just give an interview slot to them, interview spot. So this is a major thing that will, affect the future people who will, pursue this USMLE, because it has started from, I think, previous 2 to 3 years, where contacts are very important. And now that step one exam has gone pass fail, the only remaining exams which are scored are step two and step three. So they will definitely filter their application from that, filter out
Hmm.
if you don't score good. So, so these are there are definitely many obstacles, but I think, as I said, one the most important being that decide where you want to do your residency or as a career as a
Yes.
doctor in after 10 years from now,
Correct.
not exams. One is that you make you find some good senior of yours who have
Yes.
gone through this, right? Don't
Yes.
listen to everyone because it will end up confusing you.
Confusing. Yes.
Just do one thing. And the most important being, I think that lot of people, they want to know more and more. That for example, in step one exam, right, there are a lot of resources that you have to use. A lot of so many videos are there. I don't want to mention the name, but like Boards and Beyond and Kaplan and everything. So, everyone is like, I will do from here, I will do from here, I will do this, I will do UL, first aid, everything. Just stick to one resource, do it, first aid is enough, then UL is enough. So even with step two also, stick to one thing. It will really help you a lot. And try to understand how the questions are going to be asked, not just memorize, because this exam doesn't work like that. You will not see a similar single question, right, from your
Yes.
question bank. Everything will be different. So slowly and slowly, you will enjoy the process. You will like it. But stay motivated. Relax a bit every weekend. Just go out, or just you will get you will get mad on yourself. Why did I choose this career? Why do I?
Yes.
It's definitely hard, but worth the process. If you want to go to United States, definitely. And I think Rohan, you should also share my contact number. If
Yes,
someone
I
wants
was
to ask anything, I'm very happy to help them.
correct. I was
Yeah.
going to say when you were saying find a good senior, I was like, this is, you know, an amazing senior telling you this advice. So, you are that. So we will do that. I'll put your contact information down, and thank you so much, uh, for your willingness to share that. But I don't want to cut. You were saying something, so please go ahead.
Yeah, so basically these are few things. You will also learn a lot yourself
Yes.
within the process. Everyone's different. Everyone has different path. Don't just compare. First of all, it's very, very, important to not compare yourself. You will never be the best. There will be someone who is better than you. Not
Yes.
in just this field, in every field. Okay. So you have to be satisfied with yourself. Just keep on working. I think habits, make habits. Every day do some questions, and that it will just get over step one, step two, step three, applications, the rotations. Take it step by step. If you look at the overall what you are gonna do, it will just stress you out that, oh my god, this I would study for 3 years, I would do this and that. But just take one step at a time. It will really help you a lot.
I feel this is gold. The wisdom that you have shared here, uh, this is beautiful, and I think the most value that the listeners will find. And the advice we have shared is, as you said, is not just for people pursuing this particular exam. I think it's for anyone pursuing anything, right?
Hmm.
Building those habits, staying consistent, persevering for it, setting your goals. Uh, this is so valuable. And the first thing that you mentioned, and I was like, wow, it actually touched me, is do not think of which exams you want to give. Think about in 10 years where you see yourself.
Definitely.
And I think that concept of setting those long-term goals and then seeing what step you should take to get yourself there is so valuable. Uh, wow, I don't think I can summarize what you said here. I think it was so well said. I do want to ask you though, on a tangent, how many hours did you study per week?
Oh my God. How many hours? I used to wake up at 8 o'clock in the morning, start studying at 9 o'clock. So I think on average, 8 hours, I think
A
seven to
day.
8 to 9 hours, someday even 12 hours.
Okay.
That's when I'm near to the exam.
Okay.
But I must say this, it's not the quantity, it's the quality.
Correct. Yes.
Even if you study for 5 years, but dedicatedly, and if you understand the things, it's okay. I'm
Yes.
still, it's everyone is different. You know,
Yes.
people who study for 15 hours or even 6 hours may score the same. It's
Correct.
how you study. That's
Yes.
why it's very important to have a good senior who could
Yes.
guide you.
Correct. And
Yeah.
also the what you shared about having connections, because
Hmm.
I remember this lesson I got in my university, where we had the I'm remembering the name of the department right now, but we had specifically um, a department which was allocated for career development, and they would come to each class in the university and give speech and just help us build our resume and things like that. And they used
Hmm.
to say this one thing: it's not what you know, it's who you know that makes or breaks it. Um,
Definitely.
and I think that's what is also applicable here, with, as you said, the changes in the exam system, and there's so many applicants applying, that
Hmm.
having that network and building that network around you, not just in India, also in the US, leveraging your connections is so valuable.
Very,
Uh,
very important.
yes. So I think this was amazing. I think we in future, based on the questions that we get from this, because I feel we'll get a lot. We
Yeah.
should do a part two of this podcast and then deep dive into maybe each step of the process.
Yeah.
Uh, I also loved how you shared about the resources, because I do know there is a lot of hesitancy and confusion there
Hmm.
on all these different paid resources that are out there and the
Hmm.
programs. So it's very important to pick one and stick to it,
Stick to
right?
that.
Yes, rather than go shopping everywhere and can get confused.
Yeah.
Uh, so
Yeah.
thank you. I think, sorry, go ahead.
No, 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 I'm just.
Yes, I think the gist of today's conversation with Rushi is finding a good mentor for yourself that can help you guide through the process, right? And you don't even have to find. I think the person is right in front of you. So thank you, Rushi, for coming to this podcast, sharing your wisdom. We'll stay in touch. If we get more questions, we should do a part two of this. And I'll put your contact information down for anyone who's interested and learning more from you.
Definitely, and thank you so much, Rohan, for giving me this platform, to discuss, to help others. Because I know how, if you don't know how the process is, it feels very helpless. So we are all here to help. I have some friends with me who also would like to help whoever
Yes,
needs guidance.
yes,
And so yeah, definitely mention that.
yes.
And thank you so much again. We will meet for dinner tomorrow, right?
Yes, for sure.
Yeah, yeah, yeah.
See you tomorrow. And
You
thank you
too.
everyone for watching. We look forward to seeing you in our next episode.
Bye bye.